This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
Mon Health Live for this Saturday morning. Thanks for joining us on WAJR. And of course, we've rolled this show out over the course of the last 3 or 4 weeks to just try and get the latest and the most important information out to you about the pandemic and all that entails, whether it be vaccines, whether it be case numbers, whether it be specific health situation that you might have and how COVID affects that. That's what we've been doing on these Mon Health Live shows. And David Goldberg, President, Chief Executive Officer of Mon Health Systems, is with us. Also, Dr. Crystal Atkinson, Chief Nursing Executive for Mon Health System. Welcome back to the show, both of you.
Good morning.
Good morning.
Happy New Year.
Yeah, thanks for coming on, and we'll get into some details, the latest information here in just a couple of moments. We also have a special guest that is joining us, and Dr. Ihtishaam Qazi is with us. And Dr. Qazi, thanks for coming on. We appreciate it.
Oh, thank you for having me. I appreciate giving the opportunity to talk to you guys.
We'll get into some specifics about your area of expertise, but let's start with, introducing yourself and what your role is with Mon Health System.
Oh, thank you. So I'm the medical director for oncology here at Mon Health Medical Center, and obviously, as a provider, specializing in cancer and blood-related disorders, that's our primary focus here. We offer the latest treatments for a broad variety of cancer. And in these tough times, we've had to do, specifically address the COVID-19 the COVID-19 pandemic. And I'm proud to say that we have been able to really aggressively, be able to provide good quality care during the pandemic and keep our patients who have very significant, medical issues and diagnoses safe during these tough times.
Mm-hmm. David and Crystal, let's get the latest from you in terms of case numbers and whether we've seen a little bit of bump in cases as maybe we expected after Christmas and after the holidays.
Yeah, this is David. Good morning. We've been pretty steady with our census of COVID-related patients. We see between 20 and 30 a day, 8 to 10 of those in the intensive care unit, on a ventilator, not on a ventilator, and then on our medical floors. Our emergency room continues to see people with signs or symptoms. Our walk-in clinics, either down at Fairmont and our Wedgwood facilities that do the antigen and rapid testing, are seeing more people present. And, of course, you heard Dr. Qazi talk about our oncology patients or cancer patients. But our cardiology clinics, our pulmonary clinics are seeing increased concern, those who have already a sickness, and then, of course, signs or symptoms in respiratory season, in flu season, in the GI bug season. Minimal flu, lots of COVID, but we're managing well.
Mm-hmm. Why do you think there's minimal flu? Is it because of all the precautions we've taken to avoid COVID, whether it's hand washing, mask wearing, social distancing? Has that helped keep the flu numbers down?
I think that does play a part, Kyle. I think, unfortunately, because COVID is so, we're seeing that the transmission is so easily passed from one person to another. I think we're just really seeing the increased numbers there. Fortunately or unfortunately, we're just not seeing that flu. And I think that where we are across the state, and as we typically see increased hospitalizations for flu, it probably is a blessing in disguise, as those beds in the hospitals across the state are really focused on care for the COVID patients.
Yeah, and if I'll add to that, we test for flu when people present along with COVID. So it's not like you're only being tested for COVID. We're just not seeing the significant presentation. I do think it's because people have socially distanced somewhat and haven't spread it. Kids at home, who usually after Thanksgiving and Christmas might gather during the holidays get back together, and flu usually picks up around into December, into after the New Year, and maybe people actually got the lesson and started socially distancing more Christmas into New Year's, and now here we are, the first week of January.
Well, the kids haven't been in classrooms either, so those are breeding grounds for the flu oftentimes, and I guess that the opportunities for that to spread haven't been as prevalent.
That's true.
Absolutely.
Very true.
Okay, we're going to get our guest in here, again, Dr. Qazi, concerning cancer and how COVID has affected this. Let's start there. How has cancer treatment changed with COVID-19?
It's a very good question, and actually, just kind of hopping on the topic of the flu. For many years, the cancer providers have had to, weather the flu season with a lot of the same precautions we do now. We have always historically kind of had our patients during the flu season try to social distance, have visitors wear masks. If they had symptoms, don't visit. So for both the patients and the providers, that was kind of like a practice run for this pandemic. Specifically with COVID-19, obviously the patients who have cancer are at higher risk. Recent or current chemotherapy or regimens, they put them at a higher risk for COVID complications. We know that from both data from China and then now in the last 6-7 months with data from across the globe. So one of the things that we are always kind of battling, and weighing in terms of people's treatment is what's going to be more deadly for them. And sometimes we had to scale back and think, wait, cancer is a very deadly diagnosis, and therefore we can't hold their treatments until this pandemic passes. So obviously we need to get people in for treatment. And luckily there have been some developments in terms of cancer treatment that have helped us be able to kind of minimize the to and fro to the cancer center. For example, one of the newer kind of treatments for cancer is called immunotherapy treatments. You might see the commercials for Keytruda and Opdivo. Luckily, last year the FDA was able to approve a longer interval between treatments for several of those agents, and that has helped minimize some of the visits to the cancer. Instead of being every 3 weeks, go to every 6 weeks. We've also had some patients when there's an option to use pill chemotherapy, we've been able to do that. The most important part has been just a beefing up of our own internal practices here of preventing transmission. And I have to say I'm extremely thankful for having a great administration who really early on locked down our practices and procedures here. I have a great service line director, Reagan Psycho, who has got almost like I would say an honorary infectious disease degree here, and we really have made this cancer center as safe as humanly possible for patients and their care. We've had to limit sometimes patients, their families and friends coming in. Our infusion center is a extremely tightly regulated place, heavily sanitized. Luckily we have a great deal of PPE to use, and when we can get our treatment regimens a little more a little bit safer and adapting to our patients, we do. And then in the patients who we can't do that, who really need that treatment every 3 weeks or sometimes every 2 weeks, we are making the actual environment of the cancer center as safe as possible. And I'm just really thankful for the team that we have here to be able to do that.
Mm-hmm. Dr. Qazi, you mentioned that folks with cancer are a little bit more susceptible to this virus, to COVID-19. Is that simply because their treatment kind of batters their immune system? Is that a part of it?
Yeah, primarily, that is correct. The treatments that we do give, they do bring the immune system down, and sometimes the actual disease state they have, like if it's a cancer of the immune system, that can also make them a little more susceptible. But again, that's actually where we're also maybe doing a little better, is that now we do have non-chemotherapy based treatments, the newer treatments are more targeted to the cancers themselves. And so, like I said, those immunotherapy treatments I just mentioned, they actually augment our immune system to go fight the cancer. So we don't think that is a as immunocompromising situation as our traditional chemotherapies that we've used in the past. Again, one of the great things about cancer care in America today is that with all these advancements we've gotten to, we're using less chemotherapy than we did just a decade ago, and that is actually translating to patients who are not going to be as immunocompromised as before. But like I said, each individual cancer has to be evaluated for the appropriate use of those medications. But that is helping a little bit in keeping people with a more robust immune system.
Mm-hmm. Absolutely. We are with Dr. Ihtishaam Qazi of the Mon Health Systems, also David Goldberg, President, Chief Executive Officer of Mon Health System, Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health System. This is Mon Health Live for this Saturday morning. We've got a lot more to get into. We're going to take a break, more about how cancer patients are dealing with this, and we'll talk a little bit, get an update on the vaccine as well. Stay with us. The program continues on WAJR after this.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
David and Crystal with us on this Saturday morning edition of Mon Health Live. We're going to talk a little bit about the vaccine here in a couple of moments and get an update. But we're also joined by Mon Health Oncologist, Dr. Ihtishaam Qazi, and we're talking about how COVID-19 has affected cancer patients. First of all, welcome everyone back to the show. And Dr. Qazi, again, life goes on through all of this, and I'm sure each and every day you're seeing people coming to your facility and they're getting that cancer diagnosis. The pandemic isn't stopping that, unfortunately, and I believe we just lost Dr. Qazi from his line. Hopefully he'll join us. He'll call us right back. But let's pivot to David and to Crystal here, and let's talk about the vaccines and where we stand with that. Give us an update.
So, let me give you a sense, if I can, where we are in vaccination. So I reported out I got my second shot this week. Little sore arm, no third head, no microchips in me. I'm feeling great. Still have to mask and take every precaution everybody else still does, so it gets into my system over the next 15 days. Here at Mon Health System, we're following the federal government approach, and then our governor, rightfully, in a great plan with the National Guard, has put a plan in place that's working extremely well. We at Mon Health Medical Center have given about 750 vaccines to staff, frontline staff already across our system, about 1,220 or so vaccinations in our 4 hospitals. So we're real pleased. Most of our people are taking it because they want it. Our allocations get reduced a little bit from the federal government down, but the state has not reduced the allocation to our hospitals to be able to continue to vaccinate our frontline, first-line responders. And then, as you can see, we're starting to roll out to age 80 and above. In the state, we're trying to vaccinate all of our school administrators, teachers, and people, so we could make sure they have it in their system when the kids come back. We know at colleges they're doing the same as we're getting ready for students at WVU and Fairmont State and others to come back. So we should be very pleased. At our village at Heritage Point, every resident was vaccinated for the second time. No outbreak there, knock on wood, with any of our residents. So I couldn't be more pleased where we are, at least from a Mon and a regional perspective.
All right, so again, this vaccine is rolled out systematically, and as you mentioned, David, we're to the point where people over the age of 80 are getting the vaccines, and the folks who got the first shots are now getting their second shots. So we're making progress. We're getting there. That still doesn't mean, even if you've been inoculated twice, that still doesn't mean you shouldn't take these other precautions, correct?
Absolutely, Kyle. And one of the things, we actually have staff that come through and just say, hey, I got my vaccine, and are we still screening? I want to be very clear. we are still screening, we're still masking, we're still social distancing, making sure that we're utilizing great hand hygiene, etc. So until we get to that place where we feel like the vaccine has 100% efficacy, we're still going to have these same precautions in place.
Mm-hmm. And we talked about the flu earlier, and again, hopefully long term, people have changed their habits. Obviously, through this, they're washing their hands more. They're wearing masks. They're a little bit more concerned with general hygiene. So hopefully, going forward, after we get past this pandemic, people will still use these good habits, and maybe we'll beat back the flu a little bit in future years.
And we're in the medical field, so I'm going to, hashtag trust the science. I got my flu shot. I got my COVID-19 shot. I'm living proof I don't have 13 limbs and 14 eyes. I'm not more crazy than normal. But at the end of the day, the science speaks for itself, and we have to do our part with masking, washing our hands, be socially distant. And when we have a vaccine that can impact us in a positive way, I couldn't stress more how important it is for all of us to own our health care.
Mm-hmm. We've got Dr. Qazi back with us. Doctor, any thoughts on the vaccine?
Yeah, I actually have I want to jump in on what David had said. I obviously got my first shot back in the first week, and thankful that our hospital was able to get those, in a very timely fashion. I have my next booster here tomorrow. A lot of people have these questions, and I can tell you, I've been having to spend a lot of time with my patients, educating them on this. I want to just kind of give my own personal, background. I've done a lot of my medical training here in West Virginia. I did research at Case Western Reserve University in Cleveland. And I think one thing that is bothering some people is that they think that this thing has been rushed, and how can we make a vaccine so quickly? Some personal context, I did a lot of kind of bench-side research, for over the last 20-some years. And one thing I think people, really need to, kind of like help in giving that perspective is, back 20 years ago, 25 years ago, we, even at that time we had all these advancements in biomedical science, but really we've had just an explosive growth of scientific knowledge and advancements that really have, just catapulted us forward. And that's really, has been born on the backs of each of us taxpayers paying to fund biomedical research. This is the clear fruits of the labor that the funding from the government into biomedical research. I'll give you an example. When I used to do research, back 25 years ago, doing simple things like genetic sequencing was a really complex experiment, taking weeks and months to just do a simple amount of genomic sequencing. Back then, doing the Human Genome Project, I was one of my mentors was on the Human Genome Project, and those efforts took years. We sequence this virus in, we're talking days to weeks. I mean, we had all that information, and that's just why we've been able to get this vaccine so quickly. Is when we have that scientific knowledge. Myself, obviously, I had no qualms taking it, but I'll give you a very personal example. My wife is currently pregnant. She's also a nurse and front line provider, and she sees Dr. Prettyman here in OBGYN, and he's been a very big advocate also for the vaccine. And I did we did our own research in this, and we felt that because she's still seeing patients, that she should get the vaccine, and she got her first vaccine yesterday. And like I said, I don't just advocate it for my patients. The American Society of Clinical Oncology, a lot of the clinical organizations in different fields, including that of the American College of Obstetrician and Gynecology, they have said that they feel that the high-risk, persons, people who are immunocompromised, they should be able to get the vaccine. They should get the vaccine. From my perspective, I've been really advocating on my patients to do it, but I believe it enough that my family's got it. My parents are in Kanawha County. They're in the age of 80 to also receive it. They will be getting it, and again, just really want to convey that to all the patients, in our listening area that, we're not just advocating it for people to take without taking ourselves. We are for ourselves, for our families. We are, in the front line to get it, and just really want to encourage everyone to get it when it is available to you.
Yeah, absolutely. Very important. All right, we've got about a minute left in this morning's show. David and Crystal, any information you want out there?
I think it always goes without saying, please, if you're not feeling well, call your doctor. We can see you by telemedicine. We can schedule you an in-person visit, or there's always our emergency rooms. Don't let your health care be delayed because of the pandemic. We want to make sure you stay healthy as possible.
Mm-hmm. And Dr. Qazi, that includes cancer patients as well. As I said before, life goes on, and I'm sure, unfortunately, every day you're seeing patients that get that cancer diagnosis.
Yeah, and it's just important to get them in and treated, because we were having a lot more success in treating people, but it's important to get them treated in a timely fashion. The more you delay, the more we risk losing success in treatment.
Mm-hmm. Dr. Atkinson, final thoughts.
I always also want to just comment on if there's information that people need to understand and learn about the vaccine or anything from COVID-19, they can go to monhealth.com/coronavirus, and we have all of our information there.
Mm-hmm. All the information of the website. I'm sorry, did I cut somebody off there?
No, sir.
No.
Okay, all right, very good. Thought someone was trying to get a last comment in there, but we appreciate it. Our special guest this morning, Mon Health Oncologist, Dr. Ihtishaam Qazi. We appreciate your time. Thanks for coming on.
We appreciate having us. Thank you so much.
All right, Dr. Crystal Atkinson, Chief Nursing Executive. Again, thanks, and David Goldberg, thanks for your time as well.
Thank you,
Thanks,
Kyle.
Kyle. Enjoy your weekend.
All right, you too. That is Mon Health Live for the Saturday morning, 104.5 FM, 1440 AM, WAJR.